Heidi, I appreciate your participation in the intake so far. I want to change to a new section, if that's okay with you. And this section is on substance use. Is that an area you feel comfortable discussing?
Sure.
All right. So, are there any substances that you currently use?
I drink a bit.
Can you tell me how often you drink?
I guess it's more than a bit. I would say I have probably 3 drinks a day.
And what are you drinking?
Beer.
Yeah. Do you know what size?
The bottles, I think there's 16 ounces.
3 bottles of beer a day?
Yeah.
And how much time does it take you to consume those?
Probably a couple of hours.
So, every day, 3 beers in about 2 hours.
Yeah.
Does that do anything to you in terms of your mood or feeling?
It just kind of helps me unwind after a long day of work, relaxes me.
So it's relaxing for you?
Yeah.
Has it ever gotten you into any type of trouble?
There was one time that my friends and I kind of got into a fight after I had been drinking, and we almost stopped talking because of it, but we were able to work it out. But I've almost lost friends over it before.
All right. Is there any other areas where it might disrupt functioning?
Sometimes it's hard to get up and get to work the next morning after if I drink it like later in the day, it's hard to get up and get to work on time the next morning. So I've been late a couple of times too.
All right. So, three bottles of beer, pretty much every day?
Pretty much every day.
Pretty much every day. Has there ever been a time when you've consumed more or less in a particular day?
Not typically during the week, but sometimes I'll drink more on the weekends. I'll maybe drink like my normal 3 in a couple of hours, and then maybe 3 or 4 hours later I'll have a couple more.
You have a few more?
Yeah.
And how long have you been drinking alcohol?
I guess I started when I was around 17.
17?
Yeah.
Now you mentioned beer. Have you ever consumed any other type of alcohol?
I've tried wine and shots before, but I always kind of just gravitate more towards the beer.
Back toward beer?
Yeah.
All right. Any other substances that you use currently?
On the weekends, every once in a while, I'll smoke some pot. With my friends, like Saturday night.
That's pretty much just weekends?
Sometimes during the week, like before I go to sleep, I'll have a joint. Just it helps my anxiety and my worries before I go to bed.
All right. When did you first start using marijuana?
That was probably a couple years ago when I first started college.
About 2 years ago?
Yeah.
And on the weekends, sometimes, other times?
Yeah, actually I guess it's more on the weekends, but I would say maybe every other day during the week.
So mostly on the weekends, occasionally during the week. Has it ever led to any trouble or change in functioning?
On the weekends, no, because I don't really have anywhere to be. But sometimes during the week, if I again, kind of like the alcohol, if I smoke it too late, again, it's hard to get up in the morning and get to work on time. And my boss is really starting to get irritated with me with how often I've been late. Not that I'm like super late, but I'm late enough.
Have you ever tried to cut down on the substance use, alcohol or marijuana?
I've tried to cut back on the alcohol before. About a year ago, I tried. I was when I started this job that I have now. I tried to cut back when I first started, and I was able to get down to like 1 or 2 beers instead of 3. But then the job got stressful and I got comfortable, I guess, and started drinking more again.
So you think perhaps the alcohol use is connected to the stress with your job?
I would say it's definitely connected.
All right. Have you ever been annoyed by people that perhaps criticize your substance use?
Yeah, my family can be critical of, they don't really know about the marijuana, but they can be critical of my alcohol use.
All right. And that bothers you?
Yeah.
Have you ever felt bad or guilty about your substance use?
I felt guilty with my mom because it upsets her so much sometimes. Like, I'll feel guilty about how my substance abuse upsets her.
Mm-hmm.
And sometimes I'll feel bad, like, if I have a fight with my friends, if I'm drunk, I'll feel bad the next day about getting into an argument with them because it's usually over something silly.
All right. Have you ever had to drink or use drugs first thing in the morning to steady your nerves or to lessen the effects of a hangover?
I would say not during the week, but on the weekends when I'll drink a little bit more, sometimes I'll have just a little bit. Like if I drink Saturday night, I'll have a little bit Sunday morning to just get going in the morning.
So on occasion that happens?
Yeah, I wouldn't say it's often, but on occasion.
So alcohol and marijuana, two substances you currently use.
Mm-hmm.
Can you tell me about substances you used in the past?
At a party one time, I tried ecstasy, but I didn't like it, and I ended up not really hanging out with those people anymore, so it wasn't an issue.
So just the one time?
Yeah, just the one time.
All right.
In high school, my friends, a lot of my friends were smokers, so I smoked cigarettes, but it just made me feel sick, and I didn't really like it very much. It didn't really do anything for me, so that didn't last long.
So you discontinued?
Yeah, that didn't last long at all.
All right. Any other substances or just those two?
Just those two that I'm currently using, and then just the smoking and the ecstasy previously.
All right. Do you have a family history of substance use?
My grandfather, my mom claims that my grandfather was an alcoholic.
All right. Any other history?
No, not that I'm aware of, at least.
Before I move to the next section of the intake, while we're still talking about substance use, is there anything else you want to add? Any other comments you want to make about this section?
I don't think so. I think that covers it.
Does that cover it pretty well?
Yeah.
All right. I appreciate you answering these questions, and if you're okay, I'm going to move from this section and move to the next section of the intake.
Okay.